Welcome to the Unhealthy Policy Podcast, where we break down how policy decisions in Washington actually play out in our hospitals, clinics, and communities. Today, we are discussing the massive and immediate cuts to the Department of Health and Human Services. I'm Jake, and I'm joined today by my co-host, David.
Jake, word has come down in the last few days about some pretty massive and highly impactful cuts to the Department of Health and Human Services, with an estimated plan to cut 10,000 jobs. This comes on top of $12 billion in grant funding that was cut from the states without warning a couple weeks ago. We're kind of in the middle of a major reduction in our healthcare workforce at the national level that's paired with reductions in our ability to do research at the local level.
Very serious policy that we're going to be talking about today, and we're going to try to break it down because this is happening really in real time. Before we get to that, David, I love binging Netflix. If there was a Netflix series about your life, what would the title of that series be?
Well, Dick, I just like the idea of you binge watching Netflix, shirt off, beer in hand, bucket of chicken on your lap. I've always thought when I die and I'm laid out, 6 feet under with a headstone, I've always wanted to say, here lies a damn good time. And so I think the title of the Netflix show might be Damn Good Time.
I love it. And I see the skull behind you. The skull behind you also had a damn good time, whatever you did over there.
Yeah, it could have also been He Lies. So that would have been hopefully not. That's the alternative title, depending on who you ask.
I don't think
Not on this podcast.
Yeah, I was gonna say, I don't think that's a great thing to say, David, as we're about to launch into a podcast here. So let's bring it back to the topic we're talking about. David, what is HHS?
The Department of HHS, or Health and Human Services, is a cabinet level agency that's in charge of determining national policy around health and how we kind of treat the poor in our country.
Yeah, David, and the motto of HHS is improving the health, safety, and well-being of America. I think we can all agree that sounds like a great thing.
Yeah, I think it's something that all Americans have agreed on is a key part of what it means to be a healthy, functioning society for a long time. And just to talk about some of the other agencies that are part of the HHS, there are a lot of big names in here. One of them is the CDC, or the Center for Disease Control and Prevention. Another one is the NIH, or the National Institute of Health, the Food and Drug Administration, which regulates our food quality, our drug quality, vaccine quality, the Center for Medicare and Medicaid Services, or CMS, and then the ACF, Administration for Children and Families, so that does welfare, childcare, and family support services, as well as others. There are a lot of different agencies, 7 in total, that are pillars of this HHS that really have an enormous impact on the day-to-day lives of Americans.
David, when you were listing out all the agencies under HHS, I can't think of one person listening to this podcast, or really one person anywhere in America, that is not directly impacted by those agencies.
Yeah, their reach is enormous and the benefits that they bring are equally so. Anybody over the age of 65 qualifies for Medicare. So the insurance plan for the elderly for Medicare was implemented. Old folks basically just didn't have any health insurance options and often struggled to get any kind of health care, even though those were the people of greatest need. And Medicaid is a similar program that provides insurance for people below a certain income level. So poor people in the country, as well as their children. So poor children who aren't able to otherwise have insurance coverage get covered through the Center for Medicaid. That's just the CMS, let alone all the other agencies.
We're going to dive a little bit into the specific cuts, but I think it might be worth talking about some of these sub agencies in a little more detail. And one that we're all familiar with, but may not know how it works, is the FDA. So, David, what happened before the FDA existed with medications, and what happens now?
In the early days of medicine, when it was starting to become a little bit more mainstream, we were going from, total quackery into a little bit of scientifically driven understanding of how we can give care, not all just mercury for syphilis. And as doctors were providing care, they would do a lot of the compounding of different medications themselves. So literally an individual doctor would be mixing chemicals, binding them up together, coming up with, random potions, pills, and tablets, and then giving that to patients. And that was just how it was done. There was no other system in place. As companies started kind of getting bigger and making more and more medications that they would sell, there were a variety of challenges around manufacturing those medications and ensuring that they were done to a certain standard. That Problem also happened in the early days of vaccine development. Different vaccine manufacturers would have different protocols and different standards. And it was very difficult to determine if a given vaccine was efficacious or not, or even if the manufacturing process for one type of vaccine was up to standards that would ensure that the product worked regularly. And these are complex things to make.
Yeah, right. Like, how did you know if the doctor who's giving you a vaccine mixed it correctly, it wasn't going to work? There's nothing was standardized. And I think it's been nice to know for sure when you're picking up that medication from the pharmacy or you're going to your doctor to get the vaccine, you know exactly what is in there and exactly how much you're receiving.
Yeah, and there was an interesting story of soldiers. They were given the typhoid vaccine, but the dose was like 10 times the normal dose. They got the vaccine because some guy was just making it. He was the one tasked with making it, and he just kind of messed it up. It ended up causing a ton of gross illness for these soldiers who were fighting away in trenches. Yeah, you can imagine what that was like.
Typhoid in the
Typhoid in the
trenches.
trenches.
That could be your Netflix show.
It was kind of a crapshoot, literally in this case, about what kind of dosing you were getting. It's wild to think about because it's just so ingrained in us that we have things that work, that they're given to us in the quantities that are as advertised. And a lot of that is done through the FDA.
Yeah, it's amazing the wild, wild west that medicine was even like 40 years ago. I think people just think it's always
Yeah.
kind of been this way, and it really hasn't. And because of these bad experiences, wrong doses, side effects, etc., really that's why the FDA was formed and a lot of these agencies.
It's a really interesting concept. The FDA is a way that instead of individualizing risk, so a doctor makes a compound and hands it out, or a single vaccine manufacturing facility makes these vaccines with their own protocols and then just sells them to people. What we've done as a society is said kind of collectively that no, that's not the way we want to do this. We want to have a collective determination about the level of risk that we are willing to tolerate. The FDA sets that collective level of risk. In a complex process, determine that this is the level of risk that they're willing to allow for medications, vaccines, devices, or food, honestly, food as well, to move forward into the population and be sold to the American people.
David, I think the other agency we should really talk about is the CDC and how that relates to HHS. And what does the CDC do for the American people? I think one of the most interesting things about the CDC is why it was initially founded. There used to be a lot of malaria in the United States. And in the 1940s, the CDC was founded specifically to eradicate malaria from the United States.
Mission accomplished.
Done.
Yeah. I mean, maybe we don't need the CDC after all. They got rid of
Close the
malaria.
doors. Close the
Yeah.
doors. Controlled. Checked.
I think that's a really great point. The CDC was developed to respond to infectious disease outbreaks, but there are a lot of different kinds of infectious diseases in the modern era and some non-infectious diseases that the CDC also has taken under their wing and worked to address. The CDC has a pretty broad mandate to find and control diseases around the country. And they do that in a lot of different ways. I mean, Jake, how many times have you gone on to the CDC to get a definition of a certain type of disease? I use it all the time.
I just use ChatGPT. I don't know what you're talking about.
Yeah, yeah. Well, these days, I mean, where do you think ChatGPT source their data, you know?
I mean, actually, David, that's a great point. You need experts in this information for these LLMs to actually work. So I guarantee you that these were all trained on the CDC data.
That CDC does an amazing job of publishing not only as outbreaks are happening in real time, the CDC tracks them, publishes weekly reports on this data that clinicians use, state health officials use to control outbreaks. The CDC also has a repository of a standardized set of information that clinicians can use to understand how to treat diseases and how to look for them. It's not like that information is just born into doctors. Like we have to look it up all the time to understand what to do under certain circumstances. And we seek guidance from the CDC to do that on the regular.
I think one of the greatest successes of the CDC was really identifying the HIV/AIDS epidemic. This wasn't known. No one knew what HIV was in the 1970s. And really, it was the early 1980s when clinicians and pharmacists were reporting all these unusual cases to this central body, the CDC, some from San Francisco, from LA, from New York, painting this entire picture, invested in the research to really identify what was HIV. So you're right. It's about preventing disease, identifying clusters of disease, and really promoting the health of Americans. So, David, we've talked a lot about the past successes of the CDC. What are some more recent examples of how the CDC is benefiting Americans?
They do so much that it's hard to just point to one. But one of the interesting things is that infectious disease outbreaks are oftentimes localized to different regions, but obviously they have the potential to spread because that's the nature of what they are. Or even like a foodborne outbreak, for example. If it's a multi-state outbreak, then the different states aren't going to be able to coordinate with each other. They don't have the kind of big picture capacity to understand what's going on at a national level, and certainly not to coordinate a national response. That's what the CDC does. They coordinate national responses to disease outbreaks or just to diseases generally.
I mean, there's a listeria outbreak every couple of years or more frequently. And I know as an ID doctor, I'm looking that information up if a patient is sick and has a syndrome that's compatible to know, is there listeria in the community? Another one in the news is bird flu. So are there cases of bird flu? Is it spreading? How do we counsel patients? And then how, as Americans, are we going to potentially modify our behavior or at least be informed if we're going to modify our behavior? So it really does
Yeah.
incredible work.
And Jake, I don't know if you like having bloody diarrhea, but I don't like it. Depends on how
I
bored
might,
you are.
I might lose it 10 pounds.
Yeah, well, I mean, you haven't eaten a lot of chicken while watching Netflix, and bikini season's only a few months away. A lot of the outbreaks of this type of E. coli that causes bloody diarrhea and renal failure, those were investigated and determined by the CDC. And so that's another major win of the CDC is understanding what happened with a lot of these foodborne illnesses that we've seen in America.
The CDC has this ability to open the emergency operations center to investigate new pathogens. So when the first Ebola case was reported in 2014 in Guinea, the CDC activated this emergency operations center, implemented screening at airports, implemented testing for people who met the case definition. And I think without this body, it's really hard to prevent further outbreaks. I think we did a great job in 2014 of really containing Ebola. And thankfully, in the US, there are very few cases. The other thing that the CDC does that is fascinating to me is it trains the next generation of disease outbreak experts through a program called EIS. So, David, what is that?
So the EIS, or the Epidemic Intelligence Service, they're doctors, nurses, different healthcare professionals who are trained in investigative techniques to go in when there's an outbreak and really understand where it came from and come up with plans on how to contain it. And this group has been responsible for identifying and stopping a lot of the outbreaks that I mentioned earlier, among others. So they're really an integral part of how American healthcare works at a broader level that we don't think about too often.
The theme for this episode is all about Netflix and TV shows. They're like the house doctors for outbreaks. If people remember House MD, there's always the episode they're going to the house trying to figure out why this person was sick. It's like that, but on a national level. So there's that foodborne outbreak we talked about. These agents are going to investigate that. Say there's been a bunch of cases of syphilis. They're going to do disease contact tracing. So it really is another way to reduce the disease burden in the United States.
Yeah. And Jake, I'm glad you mentioned syphilis. I know you love DIs,
I
STDs.
do. I do.
Yeah. Tell us about what the CDC does from a STD level, an STI level.
In particular with syphilis, one concern is for babies. If moms have syphilis while pregnant, babies get congenital syphilis and you have this lifelong syndrome in most cases. So really one of the things that the CDC does is implementing these screening programs. So it's educating OBs, it's educating people to really be screened for syphilis to prevent the transmission to babies and also prevent transmission to other people.
A lot of these protocols that we don't think about, but doctors use all the time, they're why we don't worry about kids being born with congenital syphilis, or why we don't worry about babies being born who are blind because they got gonorrhea in their eyes during birth. I mean, those things are real infections that happen all over. And we don't really have that in America, in large part because of the CDC.
Pull it out the eye gonorrhea. Gotta love it. Okay, while we're talking about this, tuberculosis. It's one of the most common infectious diseases worldwide. There's almost no cases in the United States. There's still some. But the reason for that is when one person has tuberculosis, there's this huge response to figure out everybody that they've been in contact with, to quarantine when necessary, and to give effective treatment. And that really has burnt out this disease compared to what it is like in other countries. And really the public health infrastructure of which the CDC is one integral part that has made this a success. Now that we have a great overview of what is HHS and the associated agencies that are under HHS, let's go back to the policy that we're talking about today and that's the cuts to HHS and all of these agencies. David, can you give us a little more specifics?
So there are a few different cuts happening simultaneously, and there are so many things happening every day, it's hard to keep up. But recently, $12 billion in grant funding that flowed through the HHS to the states was cut. So many different states were affected. We'll talk a little bit about a case scenario in Washington state about what's happening there, my home state. And then at the same time, there have been massive cuts at the federal level that are affecting employees that do the kind of work that we were just talking about. And I have some choice quotes here. Widespread job cuts begin at health agencies. Massive wave of job cuts underway at US health agencies. It's a bloodbath, humiliating and degrading. So these are just some of the terms that are being used to describe this. And there are a ton of examples of people who are doing key work that were just told they can't go to work that day.
And the other piece about why there's all these cuts was the House, when they passed their budget for this fiscal year, decided they were going to cut $880 billion in discretionary spending over the next 10 years. Now, when you look at discretionary spending, it turns out that is going to be from HHS, or a large portion from HHS, and specifically into Medicare and Medicaid. Right now, we don't know exactly what that's going to look like, but this week we did learn about some of these cuts that you're alluding to.
It's pretty wild about how they're implementing this. They're giving no advance warning to how these things are rolling out. They're just turning off the faucet one day. The head of the National Institute for Infectious Disease, Jan Marazzo, she was just told she can't come to work.
Did you see the photo of all the people with their badges lined up that they couldn't get into their building, and that's how they found out they were fired?
Yeah, it is insane. And these are the people who are doing this important work to stop these disease outbreaks from occurring. And doesn't seem like there's been much thought to how you're actively implementing these cuts in a way that is meaningful and doesn't harm people.
One of the themes about all the cuts that we've discussed over the past couple of podcasts is they aren't planned unwindings of any of these programs. They're literally self-destructing these programs, turning off access. And I think we're seeing a lot of the negative impacts of that approach right now. And David, to this point of really them unwinding these programs without having any thought behind it, I know you have some more personal examples from your home state of Washington.
I think it's worth zooming in on how these cuts are impacting things at the state and local level. It's hard to think about them in the national sense without actually understanding their impact on the ground. And I get the Seattle Times, longtime Seattleite, current quasi-Bostonian. Go Seahawks,
Go
down with the
Sonics.
Patriots. Yeah, go Sonics. But in the state of Washington, recently, over 100 jobs were cut from a hospital near Seattle just because they ran out of grant funding from the government unexpectedly. These grants were supposed to continue, and instead, one day they were told they were shut off. A single hospital lost over 100 positions. $1 million in funding was rescinded, so that caused 226 full-time employees to be laid off. Those employees were specifically looking at ways to improve vaccination and disease surveillance in the state, including reaching out to populations that are hard to vaccinate. There was a $118 million cut to our epidemiology and laboratory capacity work, included 150 employees getting laid off at laboratories that looked into investigating outbreaks and understanding how different diseases are spreading around the state. And again, this is all just the state of Washington as an example of what's happening at the national level. And King County, the county that Seattle is in, lost grants that are working on asthma prevention in children, as well as limiting their toxic exposures. We lost 45 community health workers in King County, and those are the people who go around and actually try and engage citizens and prevent them from getting disease. So just in one state, we've seen hundreds of jobs lost, hundreds of millions of dollars in investments in our state health that are directly impacted. And who knows how many knock-on effects that will have and what further cuts are going to come in the days ahead. And again, these aren't cuts that are occurring to some bureaucracy at the national level. These are cuts that are happening within the state for workers who are actively on the ground preventing diseases. And we're seeing these happen everywhere in the country.
Just to put some numbers on it, 10,000 people were fired just this week in all these agencies you're alluding to. And that's on top of the about 10,000 that were already let go with some of these early retirements or voluntary fork in the road cuts. So 20,000 of about 80,000 jobs were lost. And these are people who are really trying to make the country healthier. I think one thing that really stuck with me, if you look at the former FDA head, Dr. Khalif, He basically said the FDA as we know it is finished. Most of the leaders with deep institutional knowledge and understanding are gone. And I think we talked about the FDA, and I personally worry, what does the approval process look like for all these new drugs that are in the pipeline? Are they going to be as regulated, as safe? Is there going to be a lag to get them approved? If it takes 2 years from the time they submit the application to get it approved, if you're someone who really wants that for their cancer, that 2 years could be the difference of life and death.
And Jake, to that point before about now the risk is on the pharmaceutical companies to determine what is safe for us. I don't knock pharmaceutical companies at base. They do really important work to provide new drugs, to manufacture drugs. My sister works for a pharmaceutical company, but I don't necessarily trust pharmaceutical companies to determine what is safe for me. That is something that I want to be done outside of the pharmaceutical companies' realms. I think that's a really important thing is that we don't want these companies telling us what's good for us. We want us. We want the American people determining what's good for us. And the way that we do that is through having these agencies that ensure that they have safe quality manufacturing.
I'll be honest with you, David. I hate regulation as much as the next guy. I was trying to redo some of our basement, and the amount of paperwork I had to fill out, I was pulling my hair out. But when it comes to our medication supply and the drugs that I might be taking, I want that independent body looking at the data, looking at the manufacturing process, and making sure it's safe. And I just don't know where that leaves us. Is it going to be that drugs are just very delayed and the FDA lag is more? Or is it kind of everything is going to be approved? And if that's the case, there's this conflict between profits by the companies, and they should make money when they develop a new drug, but it's this conflict between the profits from the companies and the safety of the drugs. And I think the FDA was a very good solution, by no means perfect, but a good solution to that really hard problem.
Yeah. And Jake, I just want to say your basement looks great. If that's what I'm looking at, you did a good job. Might have
This
taken some
actually is
paperwork to
not my
get there.
basement, but yeah,
Oh, okay.
this is
Yeah.
actually all a
It's a,
green screen.
you're actually just on your couch watching Netflix.
I think it's a little bit hard to know exactly what these cuts are going to look like. Every day it's changing. But going back to the CDC for a second, there were some specific things that just are completely eliminated. One of them is the firearm injury research arm, the Ending HIV Epidemic Initiative. Those are just completely gone. The global health security funding, which is looking at outbreaks like Ebola and others, cut by 50%. All of this just weakens us from a health perspective. And I'm just not sure exactly why we decided to do this. Like, is it just to give tax breaks to people? It just seems very counterintuitive why we'd cut all these programs.
Yeah, we just got the National Sexually Transmitted Disease Lab. So at the national level, we can't test for sexually transmitted diseases or develop our protocols around that. And I think that's not a good idea. I mean, a lot of Americans don't want to have SPPs, and we're going to start having more of them.
Good for
So
chlamydia, good for chlamydia, bad for
it's good for
people.
chlamydia. Yeah.
I think we have to talk a little bit about Medicaid and the Children's Healthcare Program, CHIP. It's unclear exactly what the cuts are going to look like. And many Republicans are saying there's not going to be cuts. And I think it's to be determined. But 1 in 4 Americans get their insurance through Medicare or CHIP. 1 in 4. And it's often children, pregnant women, those who lost their job and can't afford insurance right now. And I just think the devastating consequences that could have, we need to do everything we can as Americans to say that these are important programs. There's so many people who, if they lose their jobs, their backup is probably a Medicaid program or they're between jobs. So having this safety net insurance, I think, is incredibly important, even for people who right now may not see how it's benefiting them. David, I think what's very confusing about the Medicaid expansion programs in all these states is each state has a different name for that program. So many people don't even realize they're getting their health care through the government, through Medicaid. So David, what's your favorite name for any of these programs?
When we hear about cutting Medicaid at the national level, again, it's just some national program. Who cares? But actually, each state takes that and turns it into their own. And so in my home state of Washington, it's called Apple Health, not to be confused with Apple Care, but Apple Health is our home version of Medicaid.
And Connecticut is Husky Health. That's one of my favorite names.
Yeah, Vermont, Green Mountain Care. Love that. So it's beautiful. You get a little state branding. which is awesome. But then people don't necessarily realize that this is money that comes from the National Medicaid program that is going to get cut.
It reminds me of when the ACA was passed, the Affordable Care Act. People called it Obamacare. People hated Obamacare, but then when you told them about ACA, they loved the ACA. So I think these programs are so complicated and complex, most people don't realize that they may be directly benefiting from them. David, it's time for your favorite segment, which is talking about how much do these programs cost and how much do Americans have to sacrifice for these programs financially.
Yes, indeed. So it's a little bit hard because this isn't like a defined policy cut. This is downsizing of existing really important programs at the national level. But let's just take the CDC. So if we talk about the entire CDC as an entity, which does all this really amazing work that I talked about, its budget is about $9.7, $9.8 billion. But they do an incredible amount of work preventing tuberculosis, tracking STDs, making sure the HIV epidemic doesn't spread. So all of that really important investment into American health for $9.7 billion. If we focus in on Jeff Bezos's yacht, the Koru, really beautiful ship. This yacht is so big that it's got a secondary yacht to help support the main yacht, and that is $575 million. So, kind of cheap as far as yachts go. Get it together, Jeff. And so if you were to cut the entire CDC budget, you could buy Jeff Bezos 16 and a half more yachts. So let's round up, 17 of Jeff Bezos' yachts.
David, you're from Seattle. So I worry that you may know Jeff personally, right? Being from the same town, small town, and you might benefit from these 17 yachts.
You make a good point, Jake. You and your billionaire buddies know how good the yacht life is. This might be my best shot of experiencing it myself. Now that you mention it, I think it's better to have tuberculosis spreading around and me on a yacht off the coast of Washington.
Without tuberculosis.
I'll be TB free. Don't you worry. Jake, it's important to note that I'm not from Seattle. I lived there for 12 years. I am from Pasco, Washington, the 509, baby, southeastern part of the state.
And David, just to be clear, we don't know how much of the CDC is being cut exactly, but it looks like probably around 2 billion. So that's about 4 Bezos yachts. So a decent portion of it. And I think we've talked about all the good things that come for it.
We aren't all about yachts here. When it comes to DDCUs, that $2 billion will result in about 1.8 DDCUs. Again,
What is it? Can you define a DDCU? I know you think we have only very, very loyal listeners who have listened to our long history of this podcast. So what is a DDCU?
A DDCU is the Dunkin' Donuts coffee unit. It is the number of small cups of Dunkin' Donuts black coffee that each American has to give up per year in order to fund some of these programs. So the current anticipated cuts to the CDC are equivalent to about 1.8 DDCUs. So each American would have to give up just under 2 cups of coffee per year in order to fund these important and life-saving programs. So point to ponder.
Who's the CEO of Starbucks? Because I think they're going to be really upset at using the DDCU instead of the CBCU.
SBCU, yeah, I think it's Howard Schultz or something. He used to live near me too when I was in Seattle. We didn't hang out, me and Jeff and Howard, but we were like neighbors-ish.
All right, now it's time for my favorite segment. And that's where we talk about if the policy that was proposed is healthy or unhealthy for the American people. To remind people, we are talking about the cuts to HHS, which includes the CDC and the FDA, and really these institutions being a shell of their former self. So what stands out to you, David, about these cuts?
For me, one of the biggest concerns is that if the FDA is really hollowed out and we have to rely on drug companies and pharmaceutical companies determining what is safe and healthy for Americans, we are going to be in real trouble. And again, that's not to knock pharmaceutical companies. It's just to say that we as Americans don't determine what is safe and of high enough quality for us. Other people are going to start doing that.
Unhealthy policy.
Yeah. And so I would determine that as unhealthy policy. Jake, that's my take. What about yourself?
Yeah, analogy I've been thinking about is, since you talked about Apple Care, which is for Apple, the company, if you think about how a corporation is structured, there's all these layers of expertise from the engineers to the leadership that really understand the product and really understand how to effectively get that product to consumers. And I feel like over the last 50 years, the CDC in particular has been built up with this institutional knowledge, these leaders, they've trained the disease detectives. All of these people know so much about how diseases spread and how to keep Americans healthy that when you instantly turn it off, even if in a couple years we decide we need to turn it back on, it's going to take so long to rebuild that product of the CDC and be as effective at it as it is today. And that's what I really worry about with many of these segments that we've done. I'm always kind of like, this infrastructure we're losing just instantly is going to be so hard to rebuild.
So that sounds like unhealthy policy to me, Jake.
That is very, very unhealthy policy. I feel like we need to invent a new scale. It's like a 0 to 10 scale instead of just unhealthy or healthy, where 0 is the most unhealthiest thing you can think of, and 10 is like the most healthiest thing you can think of.
Do you know how they scale cats? They start at a 5, and if they're too skinny, they drop below 5, and if they're too fat, they go above 5. So like 5 is a very snatched cat, and like a 7 is like a kind of dumpy cat.
So how does that relate to the CDC? Are we fat? Are we
Yeah.
fat CDC or skinny CDC?
Yeah, I think right now we're skinny, unhealthy, sad CDC. I think we're at about, on the cat scale, about a 2 with
I
these
like that
cuts.
scale actually, because you are right. Some agencies can get so bloated, so inefficient that they'd be above a 5. So if 5's perfect, you're giving it a 2. I think that's fair. I was going to maybe a 2.5.
And I think in the days ahead, we might see some shifts toward funding different programs that are a wild misuse of money because they are investing in priorities that are either fully investigated or are probably not that beneficial to Americans. So I think this is a good scale, the fat cat scale.
So I think with that, we should wrap up and thank everybody for listening to the Unhealthy Podcast. I'm one of the co-hosts, Jake.
And I'm David.
See you next time.